Hello, all. Welcome to December's Atlas Provider Roundtable. My name is Carolyn Davidson, and I'm the Vice President of State Engagement, probably a familiar face at this point, and I'm joined by several of my colleagues, Leah Kaufman, Angad Buttar, Amelia Wilburn, and soon Patty Villasenor. As you enter the room, if you could fill out the welcome poll, you'll notice that we have just 3 quick questions. That would be great. And if you have any lingering questions from a previous roundtable, if you could place them in the chat, we'll be sure to triage those and address them during our question and answer section. And we'll start in just about 30 seconds or so, give people a chance to respond. I'll note that the beginning of this roundtable will be some updates, and then we will focus primarily on that question and answer so that those of you with burning questions can get those answered sooner rather than later. And so our poll results are coming in. I'm going to shift to the next slide, but Amelia is our program coordinator. If you would display the poll results once we've gotten, I'd say, maybe about 60%, that would be great. So here we are. Oh, perfect. There you can see the results. We see that most of you have received the survey, which is a huge relief. And we see that the large number of you are from Pennsylvania, as well as some attendees from Florida and New Jersey, and a good balance of titles. So we're glad to have you with us. And so just as a note, if you missed last month's roundtable, all of our recordings are available on YouTube. Certainly encourage you to watch. And the links will be included in the deck at the end of the presentation. So we will send out the deck and the recording afterwards. So don't worry, you will not miss the YouTube link. Just a quick note on who will be speaking today. And so obviously, Carolyn Davidson. And as I said, I'm joined by Leah and Angad. My colleague, Shambayello, will actually not be speaking on the call today. I'll help to kind of walk through some of those FAQs that she would have been reviewing. Quick agenda for today. We're going to start by talking about an organizational leadership roundtable. We'll talk about some key deadlines, just as a reminder, some FAQs that have come up since the last time we had a roundtable, and then again, that Q&A. And hopefully we'll get out of here early. So I'll turn it over to Angad Buttar to talk about the leadership roundtable.
Sure, thanks, Carol, and good afternoon, everybody. So we are excited to be bringing a CEO/senior leadership roundtable that we'll be holding on Thursday, January 13th, 2022. That'll be from 10 a.m. to 11 a.m. Eastern time. So please, either if you're part of your senior leadership team, please register. We'll include the link to register here in the chat shortly. But we would love for you also to spread the word to other folks within your organizations. And our goal here will be first to thank everyone, in addition to what we try to do with the providers as well, but also with the senior leaders and CEOs, thank them for their help and their assistance in Atlas and where we've come thus far, and also ask for their help as we continue our survey process in our respective states. Want to see to what extent they can help facilitate the process. We'll have remarks by our founder and CEO, Gary Bendel, as well. It'll be also a great opportunity, for this audience to ask questions. So we're looking forward to it. Again, the registration link will be included. And if you have any questions, please don't hesitate to ask. The next slide, please. So as it sounds like almost everyone on the call is aware, we're undergoing our survey process as we speak. So the deadline is Friday, January 28th, 2022. So if you haven't already, please submit the survey. It's already December 15th. We're going to blink an eye. It'll be early January. In some cases, we do have weather and other things that can get in the way. So to the extent that you can get them in sooner rather than later, we would be most appreciative. We've already received over or more than 1,000 surveys, which has been great. And so if for some reason, I think I did see on the poll that there might have been a person or two that did not receive the survey link, don't hesitate to reach out to our Atlas help desk or your engagement director as well. We'll be more than happy to get that information over to you. Next slide, please. And so as it relates to completing the survey, we have a lot of resources at your disposal. First, as you can see here, we have a survey frequently asked questions. We also have a ticket that you could submit to our help desk. And all of our tickets are responded to within 48 hours. We also have something new that we rolled out this year in terms of our Atlas office hours. So you can see the link that's included here to request a 30-minute meeting with the Shatterproof team to discuss any questions that you might have at your respective facilities. And as always, you can also reach us via email at atlas@shatterproof.org. And again, also, don't ever hesitate to reach out to your respective state engagement directors also. So again, any questions, we're always willing to help answer, and there's more than one way to get those questions answered as well. So at this point, I can turn it over to my colleague, I think it's Leah, right?
Or I'll dive in, Angit, because I know that, no, you're totally fine. I know we had a last minute switch up with our team member, Shannon Biello, but just quickly to review some of the questions that we've gotten into the help desk that Angit mentioned. And so these are pretty common. Oh, and I see also that our colleague Shannon Biello is on. Shannon, if you would like to walk through these questions, please feel free to unmute yourself, but certainly no pressure.
Happy to. Hi, everyone. So happy to see you all have joined. Zoom told me that there's a lot of people on the call, so we always love a good crowd, especially to talk about common questions and how we can fix them for you. So we've put on this slide some of our most common questions that are coming in through the help desk. Maybe you've experienced them, but if you haven't, or maybe if you do in the future, we have some guidance here for you. What I'll emphasize is that you can always send your own individual questions or comments to the help desk. We link it in these slides. We also link it in the survey, along with the reference copy and the link for office hours. So use whatever resource makes the most sense. If you have questions, we're always here. We're responding as quickly as we can. We do in order of receipt, but within 48 hours. So that gives you an idea, an estimation of timeline and when you should expect a response. I will note, because we're in December right now, there may be a slight lag because we will be spending some time with our families around the holidays, so it may take us a little while, and we hope you are too, to respond, but we'll get back to you as quickly as possible, of course, because we know that you are looking at the deadline and endeavoring to complete by our deadline in January. So, common questions. One thing that we're getting a lot of, or just enough questions about that we wanted to make sure we're clear about it here, is the time question. So in answering the time question, giving your facility hours, we want to make sure that we have facility hours for your submission so that we can display this on the site and let people know when you're open and available for intake. It requires very specific formatting, and we list that in the page when you're answering a question. In fact, you'll get a little error message if you don't put in the right format, but it's making sure there are no spaces, making sure that it's in that hour, minute, AM, PM format so that we're capturing it correctly. And then once it's in that format, it should let you hit the next button. If it looks like it's not working for you, you tried to put in the format, you're still having issues, just email us. We're happy to walk through it with you and get it done so you can make sure your hours are correct and submitted appropriately. But we just wanted to flag that because we have gotten several questions related to that, and it's really just a very specific formatting to make sure that it's formatted correctly when we put it on your profile. If in general you get an error message when you're completing a page of the survey is on several different pages, you can hit the next and the back button. If you're getting an error message, it won't let you go to the next page. It's probably because there's a required question on that page that hasn't been answered, or that there's a required box, like if you select other, that doesn't have some text that it needs to let you proceed. So always look and see if there are any of those red asterisk fields or questions. Once you respond to all those and you hit the next button, you should be able to proceed. Hitting the next button is critical because that means that all the responses you put in that page have saved, which I know is so important. So make sure that when you're moving through the survey, you put all those responses on that page, you hit the next button because then they're saved. and you don't have to answer those questions again, I do not want you to do that. If you haven't received your survey link, this happens. We have a list of contacts that we've worked with on it from our state partners, but if you're the primary contact for an organization, you're not getting emails about the survey links, just email us at Atlas. We're happy to send it to you. Again, we send that very quickly, so you'll have your individual survey link. If you oversee multiple facilities, we make sure you get all those links for facilities. Very easy to resolve. You can also submit a help desk request if you prefer, and indicate that you haven't received your survey links, and we'll make sure that we respond to you again within that 48-hour window. And one final thing, for our multi-site providers, if you have a lot of sites with similar services, I know we've talked about this with you all previously, but if you want to use that streamlined survey process where you complete one survey that functions as your source survey and then transfer those responses to your other surveys to really streamline your process and help you submit faster, you just need to email us. We'll request certain information from you all within that email. And then once you complete your source survey, we'll be able to transfer those responses, and you can submit all those individual surveys as well. When you do this, I'll just emphasize for you all that there's some questions that are site specific. So you'll have to answer some questions for each individual site of care. That's why we have you submit individual surveys for each site of care rather than for a larger organization. And each survey for the individual site of care also has to be attested. So we do offer that process. Again, if you have a lot of sites, say 10, and their services are very similar across those sites, you can transfer. You can always change a response for those larger sites. If some service differs at a very specific site, you want to make sure that that's reflected. You can change any of the survey questions. It's really just a pre-population mechanism. And then again, you have to submit a survey for each of those individual sites of care. That way that all your profiles are populated with information. So we just wanted to hit on all of these frequently asked questions. Oh, even more. Why was my facility disqualified? This is a great question. Your facility is disqualified because we have a set of sampling questions at the beginning of the survey. We don't want anyone to complete the survey if they are not a substance use disorder treatment facility. We have some cases where a facility might be more in the supportive housing space, where they're STD adjacent, or they serve incarcerated populations. So we have a set of, you'll see it when you complete the survey. I think it's 4 questions at the beginning. If you answer a certain way and you don't meet the criteria for being on Atlas, you will be gracefully exited. It's meant to make sure that if you don't meet the criteria and you stay on the site, that you don't have to complete the survey. You don't spend your time doing that. So if you were disqualified and you should not have been, please reach out to us. We can fix that. And we can talk through what some of the challenges might have been in your answers to make sure that you're within sample for a project. If you're having trouble answering a survey question, also contact us. We're more than happy to help you understand what we're asking, make sure you respond to questions appropriately. I think we talked about the survey links, especially for people who you're the primary contact for multiple sites. That can be confusing. Just reach out to us. We can make sure that you have a link for each individual site of care. We want to make sure you have that. Oh, and the URL. This is one question we're getting a lot of, similar to the hours of operation. The facility URL, when you submit it, has to be in a specific format, that https://www. If you go into your browser and you copy it directly from your browser, it will be in that format already. So you don't have to type out that beginning segment, but we just wanted to flag that for you all because it's a little bit tricky. It's just to make sure that when we import it and place it on your site, it's in the appropriate format, but wanted to note that just in case you've had some trouble with that question. And that's it. Those are all my content. Thank you so much for listening. Again, email us. We love answering your questions. Submit a help desk request because that allows us to get even more specific information from you. And if you want to spend more time with me or my colleagues talking through your specific issues on the survey, please sign up for office hours because we want to help you. You're doing us a service by submitting the survey. So we're happy to spend our time helping you submit that for us. Thank you so much.
Thank you, Shannon. Shannon got the hardest part of this, so I'm happy to say that my first slide is a polling question. As many of you know, we're always trying to figure out how to increase the value of doing the survey and to just make it a valuable use of your time. So I think Amelia is going to go ahead and put a polling question up. We wanted to know if you would be being entered into a sweepstakes for prizes would make you more likely to complete the Atlas survey. So go ahead and take a minute to complete that. And let us know what kinds of prizes would be most appealing. All right, we'll give you another 30 seconds to finish that one up and click submit. All right, so everyone's answers then. Amelia, we can go ahead and close it out. Thank you so much. Always appreciate your feedback. Now on to the next slide. So Shannon, thank you so much for mentioning the Streamlined survey process. So just to reiterate briefly, if you do have 2 or more facilities, we heard facilities last year say that it would be useful if we could help them by transferring information where facilities have similar or the same policies and procedures. So as Shannon said, this option is available to you through Friday, January 14th. So please let us know if this is not something you're already doing and you have multiple locations. As Shannon mentioned, it's about 70% of the information from that survey that can be transferred to your other facilities, and then you'll just finish out by answering questions related to things like staffing, ADA access, and things that will always be different from site to site. And then you will continue through with the CEO or leadership member attestation, and you'll be able to submit that. And the beautiful thing is that next year, when we collect the survey, you'll find that your surveys are pre-populated. So it'll automatically be less work the second go around. And over 50 facilities have already chosen this. We'd love to see at least another 50 do so. So please let us know if you have any questions about that. Next slide. So we frequently get questions about the value of participation in Atlas. I know that you all have many competing priorities. You're often submitting information to others like the state, like your health plans. But we find it helpful to share the feedback that we get from providers who have done this in the past. One of the things I actually heard from a facility in Oklahoma the other day who said 2 things. One, that took a lot more time than he thought it was going to take. But that going through the survey questions and gathering that information from the various staff at their facility, he thought it was a really useful exercise because they didn't have all of that information in one place. So I will just add that to the other comments that we've compiled here from providers. And I will say that once you all finish the survey process, if you're not already aware of this, you get access to password protected portals. And so within those portals, you're able to look at not only the information that you submitted, but information that on other facilities in the state. So you can compare how your facility is operating compared to others. And I think that, as I was training some Louisiana providers who did this survey in the last go round, they talked about how valuable it has been to see the patient feedback dashboard in particular. So this is, if you're not aware, in addition to the survey we are collecting from you, we will work with you to get feedback from patients. And then once the website is live in next spring, patients will be able to go right on the site and leave a review. So you will then have this dashboard you can log into, look at their free text feedback. You can download that information. Shannon's team has done a ton of work integrating Power BI, which is a really fancy software that allows you to parse through the data. So you can look at both your facility, you can compare it to how the county's doing, you can look at what's happening across the state. So I think that that will be something to look forward to after we get through the hard part of getting all that information in. And if you're interested in hearing more from providers, always better to hear from them than us. We do have, this is a hyperlink, right, Carolyn? Yeah. So this, you'll be able to take a look at this later. We have information on YouTube from them. Next slide. And this not from providers, but just other folks across the country who've shared on this. A lot of you are probably familiar with the Leapfrog group, the Office of National Drug Control Policy. I'm just talking about some of the benefits of Atlas and why it's important. I know that as an organization, we always like to focus on the use to the end user, right? So just making someone's journey to find treatment a little bit easier. Being able to go on and search and find a program that specifically caters to someone who might be pregnant and looking for a treatment program, or who's looking for a program that has Spanish language staff. If you missed the announcement a couple months ago, we now have Atlas available, not just in English, but in Spanish as well. So all exciting things. The link is here as well if you want to take a look at these testimonials. Next slide. All right, so that brings us to what's been a very quick webinar. We have one more event coming up. Not to say you won't see us if there's in-state events that we're speaking at, and I'm sure many of us will be emailing or talking on the phone. But our next webinar is January 5th. Registration list. So if you haven't, before you go out for the holidays, make sure to go ahead and register for that event. And then you're always welcome to contact us in the interim with any questions you have. I believe or it's at the end. Our next slide. Yeah.
I think that Leah may have frozen.
Oh, I'm back now.
Oh, yes.
Good timing. Yes. All right, Q&A. So I will turn it over. I think Amelia is facilitating our Q&A session for the day.
Yes.
Please feel free to put your comments in the chat. Yep.
Yep, feel free to put anything in the chat you don't want to say aloud, or we invite you to unmute yourself if you're comfortable and ask your question to the group. But if not, I'm happy to read your question for you in the chat.
So I will start with a question while you all are thinking of them. A question I got the other day was related to how we're showing telehealth in Atlas. And I'll probably go ahead and put Shannon on the spot, since I know we've, since COVID, we've been making modifications to better show how facilities are making telehealth available. Shannon, did you want to take that one?
Yeah, so when you complete the survey, you'll notice that we do ask about the types of telehealth modalities that are available through your site. So we are collecting that information from facilities. And then in the beginning of 2022 onward, we'll be really endeavoring to sit down, look at the site, and think about the ways that we redesign our content. That'll be a strong focus towards the beginning of the year and entering into the latter parts of 2022. So the incorporation of telehealth information will fall into that bucket, since we have those data from your facilities, making sure that we display the types of telehealth services that are available through your site, since that is a piece of information that people are interested in, and certainly something that you would want to articulate to people who are interested in your services. So it's a stay tuned, but it will be part of some of the enhancements we bring to the site in 2022.
Shannon, thanks for that answer. Oh, sorry, Leah. I just wanted to.
No, I'm good. Go ahead. Go ahead.
I just wanted to mention one other question that I received lately, or just today, as a matter of fact. So our survey closes on January 28th. And someone asked, what if surveys come in shortly after the survey's closed? And so I thought, Shannon, you might want to provide some insight there. I'm going to put you on the spot again. I apologize.
Yeah, so what I'll say is that we prefer to have surveys in by the deadline. I won't say that we would prefer to have them in by the end of January. We understand though that there are probably extenuating circumstances and that facilities are managing a lot right now. We do not underestimate the competing priorities that you have now and continue to have into 2022 as COVID continues to be a thing as you're balancing your patients and their needs. So if it feels like there is a chance that you might hit around the deadline, slightly past the deadline, just let us know so that we're aware of it and we can attempt to accommodate it. We're hopeful that everyone can get their surveys in by the deadline, but we are, of course, understanding of the fact that certain things can happen. So the sooner you let us know, the better we are able to accommodate that. And again, we're happy to work with you because we know it's a lift to submit your data and we really appreciate that.
I just got one question, one direct message. So I'll read that question aloud because I think everyone's interested in the answer. Staffing at facilities can change frequently, which may impact ability to provide treatment in Spanish or other languages. How often are facilities required to update their information in Atlas?
Great question. And we understand that your services change over time, so we always want to give an opportunity for you to update your data so that it's current. What I will say is for some pieces of information, certainly things like address, phone number, as those change, just email us because we can update those in real time on our site to make sure people are contacting the right people, that they're going to the right address. You don't want them going to your old address. So those are updated in real time, and we can clarify those pieces of information are updated in real time so you know them. Other pieces like staffing information, we do collect specifically through survey items, so we need to have them in that format in our data to make sure that we're capturing them appropriately. But we are currently in biannual data collection cycles. So you have 2 time points over the course of the year to submit information. You don't have to submit both times. We're hopeful that we can get your information updated at least annually. But if something changes and you really want to adjust your survey response to reflect an update in services, you can submit during an off data collection cycle. Off being like maybe your state isn't in a data collection wave, so that you're able to update those services. That's perfectly fine with us. We can send you the survey link. As Leah mentioned, your responses will be pre-populated based upon your previous survey submissions, so it really would be a matter of going through and updating whatever piece of your services have changed via staffing so that we can make sure we have updated data from you. We love updated data, so I'm happy to hear that. We want to accommodate that. We don't want you to force to submit. If you submitted recently, that's totally fine. But if you do have an update you want to submit, you can do so during any data collection wave that occurs during our project implementation cycle.
I think that was a really comprehensive response from Shannon. So just to summarize, you can update, for instance, your facility's address and hours at any time. Once your facility is published on our website, you can log into your portal and update those, and those will get updated generally 24 to 48 hours. If you have a more substantial update or, for instance, a change in the services that you're offering, we ask that you contact us at atlas@shatterproof.org. To Shannon's point, if we're in the midst of collecting data, we'll send you your survey link. If we are for some reason not, we'll let you know when the next time you'll be able to update is. Leah, did you have another item? I saw you unmute.
Yeah, no, I didn't want to interrupt you. So we had another question. Actually, first I wanted to mention that if you haven't taken a look at this site yet and noticed that we do incorporate your website address. So we encourage all of you to put your website on there. And throughout the pandemic, because some of the information we had was a little bit older, since we'd taken a pause so providers could focus on treatment, We have dates that show the last time the information was updated in each section. And then we were steering people to websites, knowing that you all did a pretty good job of keeping your websites up to date, especially with like telehealth information, things that people were looking for. But I wanted to ask, I don't want to misspeak, so I'm just going to ask Shannon. I think we'd had a suggestion from a provider in the past about we have a phone number listed right now, but we talked about adding an email or some way that someone searching for care could be on the profile and click an email. Do we know, is that something that's coming in the next update? Apologize for not remembering that.
Yeah, so any change to the actual display of the site will be incorporated into our redesign period, which will start at the beginning of January, thereabouts. So we have, you'll notice, included in the survey a question on how best to contact your facility. We don't want to assume it might be an email, it might be your website link, it might be a phone number. It differs based upon the facility. So we have asked you to select which contact options work best for your facility, and we'll be working to create an enhancement that incorporates that contact method rather than just having the URL and phone number as you do currently. So that's another stay tuned, but part of our redesign effort. And so we're collecting that information now so we can use it later.
Thank you, Shannon. That's very helpful.
And I know that there's one question that I've gotten personally that is related to the previous question regarding how frequently you can update your information. We similarly often get the question about what to do if you will have a new facility that is coming online soon, but is not online yet. So for instance, if you're opening another site in a different part of town or a different county, we ask that once that site is online and licensed by your respective state partner, that you contact us and we will have it added to the website, and we will let you know when the appropriate data collection period is. And so just to emphasize that the survey asks about any current facilities and current services. If there are services that you're planning to have but don't have yet, or if there's facilities that you're planning to open but aren't open yet, we ask that you hold responding with those items until they are live. And I don't see that any questions have come in through the chat. I will just put up the kind of a quick reminder then to close us out. Share screen. In terms of next steps, obviously, you've heard it plenty of times. I know Angud's joke that if we were in a room, we'd all say it together in unison. The survey is due on January 28th at 11:59 p.m. Central Time. If we're eligible, we encourage you to indicate your choice to use the Streamlined survey. We ask that you share the link to the CEO Roundtable, and Amelia is going to post that in the chat again. Thank you, Nicole Smuda, for asking. And we'll post that in there. That's coming up rapidly in January. And then also we have the last Provider Roundtable date. Perfect. So that is the link to the CEO Roundtable. Again, this is focused for CEOs or other organizational senior leadership. And as Angud mentioned, we will have an introduction remarks by our CEO and founder, Gary Mendel. And we already have several different large treatment facilities registered, so certainly welcome you to join. So as a last note, if you have questions about your state in particular, please feel free to reach out to us directly. So you see our email address is there, and then Amelia posted the helpful links in the chat. So thank you all for attending. As you filter out, let us know if you have any questions. Otherwise, we will talk to you soon and look forward to receiving your survey or receiving your questions to the Atlas@Shatterproof inbox. Thanks all. Thanks, Jennifer.
Carolyn, I do have a question.
Go for it. Hi.
So I'm sorry, I was late because work. So, and
Yeah.
I've reviewed this, and to be honest with you, I even like looked and I looked to see if our outpatient was on here, because I looked at the survey and I kind of thought that I did it, but I fill out so many of these things that I'm not even 100% sure that this was the one I filled out. So is there a way, should I just email someone to check that? Is that the best way to do that?
Yes, that is perfect. You can just email us at atlas@shatterproof.org. I just put that email in the chat. And so that is our help desk team. That is Amelia, who's on right now, and our coworker, Christine. So it is real people. And they will find, if you're asking about a particular facility, it's very helpful if you send the address for your facility. So that way we can look in our system by address and say, oh yes, you did fill it out, or oh no, you didn't fill it out, or for whatever reason, we don't have that listed. We're going to check with the state. So that way we can check everything. So we know a lot of sites that are like 4 different facilities or 4 have the same name. You would not believe how many sites have footsteps, for instance, in the name. Yeah. Anyway.
All right, perfect. Thank you so much.
Sure thing.
Maybe somebody has another question they'd like to ask in this smaller environment, less intimidating.
This is Jennifer. I had submitted, hi there, I had submitted by accident. So I didn't realize hitting next at the end, that would actually submit it. So my bad. So I did just submit the changes because I thought it was going to be able to be reopened. So I apologize. So the licensure, I attached that to the email. So hopefully that's okay. And then just put the number and the answer that I meant to put on the survey on there. So one of the questions I just had was if it would be okay for you to send me the final PDF version once you guys make that the changes, and then I just want to be able to like circulate it internally to make sure all of the answers are correct before January, or the end, the January deadline.
Yeah, Jennifer, you're totally fine. We can very easily import, like, for example, if you all need to make changes, you need to import your licensing information post-submission, totally fine. We can do that, and we will. Thanks for attaching it. And then once we make those changes, we will send you a PDF of your reference copy so you can circulate it around. You can always submit through the help desk a request to change responses as long as we're in the survey data collection period, and then we're happy to make those adjustments and then resend an updated PDF after making those changes to you so you have a finalized copy.
Thank you so much. And again, I apologize for that.
Oh, there's no need to apologize. Totally fine. Very easy. We're happy to do it.
And I just got a question, Shannon, I think another one for you. I just got a question in the chat. Thank you, Lydia. I completed the survey yesterday, but of course, in the end, was told to have my CEO look it over and approve. I understand the reason, so I printed it and will be reviewed before I submit. Can I go back in, or do I have to do it all over again once it is reviewed? Shannon, I will turn that to you for the attestation question. Does a person have to go through the entire survey again once it's reviewed? Or can they just, yeah, perfect.
You should be saved on the attestation page. In fact, I would not want you to have to do that. So what you'll notice in the second to last section is there's an option to download the PDF. We recommend that if you need to have someone review it, because then they can just look through your response options, if that makes sense, if you're sending it to your CEO or otherwise. And then so long as you end it on that attestation page of the survey, it should be saved on that page. So it's really just a matter of completing the attestation and submitting it. So no, we wouldn't want you to have to go through the whole survey again.
Okay, we're now at 2:40 and it seems that our questions have tapered off. Thank you all again for joining us, and thank you for sticking around for this smaller group question session after. If you want to talk to us one-on-one, so you have some questions that you'd like answered live, certainly encourage you to fill out a request for office hours. We will schedule 30 minutes with you where we will be on Zoom or on the phone if you prefer, with you literally answering your questions live. So if that's your preferred way, highly recommend it. Otherwise, as Angad mentioned, we have the help desk and the Atlas email. So we really are here for any questions you may have. Thank you all for your time today, and have a great winter holiday. Hopefully a great end of year.
Thanks, everyone.